Righty-ho, get started then just a little bit earlier because we had our first staff student committee meeting of the semester, and today I've got a radio mic back so I can walk away from the lectern. Thank you very much for the feedback through from the staff student committee. The messages I took from it were my lectures have been kind of a bit full on, just kind of wall of facts at you, and you want a bit of a break in the lectures. Try to do it today, you'll see. As we go on in the semester, there'll be a bit of that. I think as I flagged in the committee itself, there's a challenge there because in previous years I've got penalised by students for having too much interaction in the lectures. So I'll do my best. Try to make a boring subject interesting. I do try. There's an issue around the size of the workshop groups as well. I think that's a bigger issue. I'll talk to the tutors involved and see if we can think of some different teaching techniques to try and get those bigger groups of like 30 odd students working better so you feel like you're getting more attention in the classes, but there's a resource constraint there we're working within. And then got some nice feedback on the website as well. But I'll put out an announcement through Succeed as well, feeding back on this. So today's lecture is on devolution. And all week I've been I have managed to find the time this week to be putting daily blog posts up about Scottish devolution. So the first one was the Scottish devolution Play Your Cards Right with Bruce Forsyth. Then been unpacking the Fairer Scotland Action Plan, a key new policy that's been announced by the Scottish Government over the past few days. And that's kind of I've been doing that as an exemplum, because it's me who's doing it, to you, as in this is what doing social policy as an academic subject looks like. This is what you do when you look at social policy from an academic perspective. These are the judgments you're making based on a wider body of social policy knowledge. But then in today's lecture, this is the first ever time I've actually delivered a lecture on Scottish devolution. In previous years, my colleague Douglas Robertson would deliver this lecture, but he went and retired. Damn him. I'll be talking about intergenerational inequalities at the end of semester. Not bitter about the fact he can retire at 50 odd and I'll be working until I'm 70 and I've bugger all pension. Not bitter at all. No. That's the nature. So it's my first ever time doing this devolution lecture. So what I want to cover today is first of all talk about devolution as a process and open it out to talk about yes, we are interested in devolution in Scotland because this is where we are, but it's not just happening in Scotland. It's happening across the UK as the UK's constitutional settlement changes, and we can think of it as a process. Also talk very little bit about the fact we are working or governments are operating in an environment of what we call multi-level governance. So much the government might want to do things, it is constrained because there is government above and below it that constrains its ambitions and its ability to do things. And then the meat of the lecture will be about Scottish devolution, but rather than just do you a sort of boring history of devolution and what the Acts of Parliament, the Scottish Parliament had passed, which you can get from Paul Kearney's textbook on Scottish politics. It's not boring, by the way, but that's kind of, if you don't know about Scottish devolution, that's what that book will tell you. What I'm going to talk about is that we can think about policy making in Scotland going all the way back to 1999 as being more about a Scottish approach to policy making that has certain hallmarks to it rather than being legislative or political, and that there's some deeper underlying trends to policy making there, and that's what I'll be talking about in the bulk of the lecture. So let's go back to that question that we talked about in the first two lectures. Well, what is social policy? Well, it's the range of measures the government uses to maximise social welfare. And those are taxation, transfer of payments, so welfare benefits, but also the wider basket of public services, so health services, education services, what we might refer to as the social wage. So what we're talking about when we are discussing devolution and the importance of devolution to social policy is, well, what control over these levers does any devolved legislature or government have? So let's see if any of you have actually read my Bruce Forsyth's
Play the cards right on devolution. This is my moment of interaction, so you better bloody engage with me. You asked for it. Health. Hands up if you think health is a devolved issue. Hands up if you think health is a devolved issue. Alright, hands down. Hands up if you think health is a reserved issue in Scotland. It's reserved to the Westminster Parliament. No hands I'm seeing. Nope. And who thinks it's an in-between, that some bits are devolved and some bits are reserved? Hands up, anybody. Who thinks that? Yay! Oh no, there's one person there. Ooh. I won't come and embarrass you, but I've not got my radio mic out, so I won't embarrass you, but I got one person who thinks it's in between. Well, the general consensus would be it is an entirely devolved issue. The Scottish Parliament and Scottish Government can do what they want with health policy. They can do what they want to the NHS, they can do what they want to public health policy. Foreign policy. Who thinks foreign policy is devolved to the Scottish Parliament and Scottish Government? Anybody want to put their hands up for it being devolved? Cool. Anybody think it's a reserved issue to Westminster? And anybody think it's an in-between issue, that some issues are reserved and some issues are devolved? Hands up, anybody there? You're just being contrary there. I see you, I know your game. It is formally under the Scotland Act 1999 and successive acts, it is formally reserved. But actually the Scottish Government does do a little bit of foreign policy. It has consulates in places, and also it has an international development fund. We fund quite a lot of activity in Malawi because of the deep historic links between Scotland and Malawi. But generally, most of the big decisions are reserved to Westminster. State pension. Who thinks the state pension is devolved to the Scottish Parliament? Hands up, anybody who thinks the state pension is devolved. Anybody? Nope. Was that a hand going up there? Who thinks it's reserved to Westminster? Yeah. And who thinks it's an in-between issue? Some bits. Right, well, actually, I had a question on the blog about this. It is fully reserved, and that's because the state pension is still contributory in law. In fact, it's actually just paid out of tax, but in law it's contributory. You have to pay in so many national insurance contributions to get a state pension out the end of it. So therefore, you could devolve it, but it'd be really difficult, because like somebody like me, I worked and paid national insurance stamps in England for a year, so a year and sometimes when I was a student. So if my pension was then devolved to Scotland, I spent most of my working career in Scotland, how would you work out what my level of pension would be? Would you just add up all the national insurance stamp? If Scotland, you needed more national insurance contributions than England, would I get the pension because I contributed in England? Do you see, it's that kind of complexity that this opens up when you start to look at it in that way. Welfare policy. Who thinks welfare policy, in a broader sense, is devolved? Hands up. Who thinks it's reserved to Westminster? A few hands. And who thinks it's in between? Yeah, you've all read my blog post, it seems. Yes, it's getting in between. This was the big change that happened after the independence referendum and the Scotland Act 2016. The Scottish Parliament and Scottish Government are now getting much more powers over welfare benefits. Those welfare benefits aren't associated with national insurance contributions. So things like carers allowance, and there's a list of them in the very dull consultation document I'll link to on the website. The Scottish Government is now getting control over them, but the big ones, the state pension, universal credit, job seekers allowance, employment and support allowance, they're still reserved to Westminster. So that's my bit of engagement done. Hope it's woken you up. So let's think about devolution as a process then. Well, first of all, it's not just Scotland, Wales and Northern Ireland that are getting devolution. Back in the 2010-2015 coalition government at the UK level, they started the process of developing what's termed the Northern Powerhouse. And this is the local authorities in the north of England getting certain powers over non-domestic rates, so that's a tax that businesses pay, Greater Manchester now has complete control of its own health budget. It can decide how it allocates all health expenditure that goes to the region, and also transport and infrastructure expenditure is devolved to those areas as well. And they don't have legislatures, they don't have parliaments or assemblies, that's just local authorities working together, and they've got to have that devolved to them. When you look at Northern Ireland, it's just bloody complicated. It sometimes has devolution, they fall out with each other, they get devolution taken off them, they get some devolution, they don't get other bits of devolution. They bizarrely do have welfare benefits devolved to them because that goes back to the 1920s. Yeah, it's just mad, don't worry about it, it's weird. Wales is actually more interesting, it's why I've got you to look at Wales in your workshop this week. Wales has actually seen more growth of its devolved power since 1999 than even Scotland. When the Welsh Assembly was created, it didn't have legislative powers. It was literally a talking shop that could come up with policies that didn't have any statutory force. And over time, it's gained legislative powers. First of all, it gained its ability to pass acts that were then handed on to the Queen to sign in a sort of weird way. Now it has full legislative powers. It can do acts of the Welsh Assembly. It's also gained the same taxation powers that the Scottish Parliament had in 1999, whereas in 1999 the Welsh Assembly didn't have any taxation powers. In Scotland as well, we focus on 1999 and September 2014, but we forget about all the stuff that's happened in between. So the one everybody completely forgets about is the Calman Commission. They reported in 2010, and the Scotland Act 2012 passed that gave the Scottish Parliament much greater powers over income tax, the power to borrow, and the power over a number of other taxation areas. And Susan Calman, the comedian, do you know her? It's her dad, is Mr. Calman of Calman Commission fame. We also then, of course, more publicly in the Calman Commission had the Smith Commission immediately after the vote in 2014. But the other aspect to Scottish devolution, and I talked about this in the blog post quite a bit, is prior to 1999, because of the nature of the settlement going right back to 1701 when the United Kingdom was formed, we had what was termed administrative devolution in Scotland. So large areas of public policy, such as education and health, were dealt with differently by the Scottish Office, even prior to 1999. But the Westminster Parliament was still the Parliament that had to pass any legislation. So even previous to 1999, you had this level of devolution and this difference in areas of policy between Scotland and the rest of the UK. And I think it's important as well just to bear in mind that we aren't the only country in the world that has to deal with issues of which level of our government has what powers. Most countries in the world actually are federations. They're federations of individual states who pool their resources at a national level and have a constitutional compromise between who does what. So, the most obvious one, the United States of America. Canada has provinces and territories that have different levels of power. Australia, the same sort of setup. In Germany, actually, most German Länder, the main devolved regional unit in Germany, have fewer powers than the Scottish Parliament now has. And yet most people sort of see Germany as a bastion of a country that's highly devolved. But we think of it in terms of multi-level governance as well. We have to be aware that any devolved assembly, any devolved government anywhere in the world is working in this wider context. So for us at the moment, the key sort of higher level power that limits what any government can do is actually the EU. The EU limits the tax varying powers of subnational units within countries. But most importantly, the Scottish Parliament could never, ever get power over VAT so long as Scotland is in the UK and the UK is in the EU. That VAT, value-added tax, has to be the same across every EU nation. You can't have regional differences in countries. That's an EU law that says that. So no matter how much we might want it, that as long as we're members of the EU, we can't change that. You also have the issue that these nation states or subnational bodies face two competing demands, basically. On one side, you've got tax competition. So they want to attract businesses and people to them. The easiest way to do that is to lower taxes. So famously, Ireland, talked about in earlier lectures, lowered corporation tax and got loads of companies to move into it. That means that if you lower taxes, you're going to have fewer resources to spend on social policy. But on the other side, if you're offering very good social policy, if you're offering high welfare in your country, then that might deliver welfare incentives. That might encourage people to move to your country to get those benefits. And you might not necessarily want them. Or they might be putting a strain on that system that can't be paid for within the resources you've got. But also, as I talked about with the state pension as well, you have the challenge of just the administrative challenge of devolving national systems. If you've had a national system set up for 40, 50 years, then it is just incredibly administratively complex to try and devolve that down to individual countries because it is accounted for at that national level. And as much as we might have the political will and desire to deliver that devolution, it will be almost impossible to do so without sort of wiping the slate clean and having something different for the entire country, which is very, it's a big political step for any country to do. So, right, Scottish answers to Scottish problems. Thing I didn't want to obsess about in this lecture, but I've got to talk about it, but that's why we're here. So, I roll, but let's move on. Right, so when we look at Scottish policy then, going right back to 1999 and the founding of the Scottish Parliament, we can see some key trends that mark policy making in social policy in Scotland as being quite different to what was happening in the rest of the UK. One of the key themes is universalism. Particularly in England, the Labour governments from 1997 focused on targeting services to those in greatest need in various different ways. A good example of this would be the academy schools as were created in England in the 2000s, and they had to be failing schools in deprived areas basically, and they got millions of pounds thrown at them to try and make them better. Another example would be the Sure Start childcare scheme, and Sure Start centres in England were developed in deprived neighbourhoods and offered very intensive support to families that are most marginal and needed that support. Whereas the tendency in Scotland has been towards more universal policies. So not targeting, just offering a very good level of service to everybody. And there's some really obvious sort of symbolic policies here that you could say exemplify this. The Lib Scottish Executives, they created the free personal care for the elderly. So whereas in the rest of the UK, personal care when you're older is targeted based on need, if there's a really horrible story emerging in England now of there's so little funding going into social care that nursing homes might close down. So it's, the days of social care in England are numbered, whereas in Scotland we have free personal care, and it's costing us a lot of money to support the system. Free bus passes. Yes, they have them in England as well. In Scotland it's an even better system. So that's for anybody over 60 and anybody who's disabled gets a free bus pass to travel around the country. Not really a social policy, but as I found on the blog, there's good evidence it has some positive outcomes that you might associate with social policy. It tackles isolation, gets people out of the home. It tackles income poverty by giving people something for free. And most obviously, even right back in the Lib Scottish Executives, no upfront tuition fees. So back if you were coming to university back prior to 2007, you wouldn't have to, I had to go down to my college and hand in a cheque for £1,000 every year when I was at university in England. In Scotland, you wouldn't have to have done that. you would have got a loan that came to the university that you would have then paid off after you'd graduated. So there's no upfront fees, it's kind of fees in retrospect. This continued after 2007. The SNP government in 2007 to 11 introduced free prescription charges. So in England you have to pay about £8 for a prescription if on the NHS, unless you are pregnant, disabled, yada yada yada, number of exemptions. But in Scotland that's free. Actually Wales did that before us, and even when Scotland was thinking about doing it, there was people were saying, well, if you look at Wales, what happens there, particularly on the border with England, people go across the border to collect the prescriptions, they don't have to pay this prescription charge. So that's money going out of Wales back into England. And policy that all of you probably in this room, or the vast majority of you in this room, will be benefiting from, no higher education tuition fees. So higher education, in terms of the tuition fee bit of it, is universal in Scotland. Other elements, another theme that characterises policy since 1999 in Scotland is actually innovation. So Scotland's been kind of a policy lab for new policy ideas coming into the UK and being tested. And often they've then gone out and been applied to the rest of the UK. Free bus pass is again a case of this, where Scotland was the first country in the UK to do it, although some local authorities in London had free bus travel beforehand, but Scotland was the first to do it on a national basis, and then it was rolled out across the UK. Smoking ban, originally in some cities in America and the Republic of Ireland, and in 2005 the Scottish Parliament passed legislation, and it came in March 2006. I remember I was out in Glasgow getting pissed on the Saturday night, it came in on the Sunday morning. I remember walking into Glasgow Queen Street Station on the Sunday morning thinking, something's really different here. I sort of think for a while, I was like, oh that's it, there's not a fug of smoke at the end of the platforms. Back in the lab living Scottish executives as well, you got some really interesting innovation in, rather than legislation, in actually big policy areas. So Getting It Right for Every Child was actually first published in 2006. If you're a social work student or an education student, you should know about Getting It Right for Every Child, GERFEC. It's really, really big in Scotland. It's a whole total approach to managing child protection and well-being. Really, really innovative. Still being rolled out as a policy 10 years after it was first announced. And in education as well, the Curriculum for Excellence. Really innovative, very different from curriculums in the rest of the UK, and that started back in the early 2000s as well. Moving on, the SNP Minority Administration from 2007-2011 continued this trend of innovation. This is what I'm going to talk about more for the rest of the lecture, in the National Performance Framework, and particularly 3 social policy frameworks which were equally well, which is around tackling health inequalities, achieving our potential, which is an anti-poverty policy, and the early years framework, which is a policy around interventions in -9 months to 5 years. And in those policy frameworks was really innovating in terms of actually we've got some ambitions, some really big ambitions we want to deliver. Well, how do we go about delivering them? How do we implement them? And what was very innovative there was the focus on partnership working, particularly with local authorities, to deliver that level of ambition. But what I want to argue for the rest of the lecture is that we can actually say that what we've seen since 1999, and particularly more so since about 2008, is a distinctly Scottish approach to policy making. That policy is made in a certain way in Scotland and has some particular themes that make it quite distinctly Scottish. And this is the underpinning of this Scottish approach. You won't be able to read it, you can look at it yourself on, when you look at the slides of Succeed, or just Google for the Scotland National Performance Framework, and you'll get to the Scottish Government website and be able to look at this yourself. So this was being devised by civil servants in the Scottish Government back in 2006,
And the Scottish Government came in, the SNP were elected in 2007 with a minority government, and they implemented this in the government economic strategy. And up at the top left, you have the Scottish Government's purpose, which is to focus government and public services on creating a more successful country with opportunities for all of Scotland to flourish through increasing sustainable economic growth. So everything is, all of government is supposed to be focused on that purpose. I've talked about that in previous lectures. But then below that we get 16 national outcomes. And these are oddly worded things like, we have tackled the significant inequalities in Scottish life. We live longer, healthier lives. That's the one I always like. We're supposed to have completed all these outcomes by 2017. How are we going to know we all live longer, healthier lives by 2017? I'm not quite sure, but that's what we've got. And then linked to that, on this side of it, we've got these national indicators. And these have some relation. So these are just, well, we've got these national outcomes. What will it look like if we met these national outcomes? So what will it look like if we live longer, healthier lives? And you'll see there are indicators in there about life expectancy, increasing healthy life expectancy in Scotland. This is really very different for, particularly in the UK. It's very big in North America as this outcomes approach. In fact, many of the ideas came from US states, but it is very, very different in a UK context. Very, very novel. Really marks Scotland out as quite different. The Scottish Government at all levels is focused on delivering outcomes. It is focused on delivering these 16 national outcomes. So that was first introduced in 2007. It originally had 15 national outcomes. It gained a 16th national outcome in 2011. But then since then we've also had these two important reports. That one's, the Christie Commission is more important than the Beveridge report. So, Independent Budget Review was published in 2010. I was actually a civil servant in the Scottish Government when it was published. It was really, really, really important at the time. People have forgotten about it now, and note at the bottom, it's not the same Beveridge as the Beveridge report of the Five Giants, two different people completely. But it just happened to be Crawford W. Beveridge chaired this independent budget review. And the independent budget review was, the Scottish Government had realised after 2008 in the financial crash, the money that the Scottish Government was going to have to spend was going to be a lot less. So they had to change how we thought about what the government spent, basically. Have some really, really big discussions and some really big ideas on the table about how can we deliver good quality public services with not much money in the future. And the Independent Budget Review gave some really key answers to those questions that then rolled on. One of them was we need to get greater economies of scale. So you'll notice when Police Scotland was created, and that came out of the Independent Budget Review. So that was getting all the old police forces together, creating one big police force, and supposedly one big police force would be cheaper to run. And the other elements in the Independent Budget Review was to start thinking about, well, if we've got 16 national outcomes, can we start spending towards the outcomes? So should we link what we spend as a government to delivering those outcomes? And then that led on to the Christie report, which is the more important one, the Christie Commission report, published in 2011. And it really did, it set the tone for policy sense. And if you talk to people in Scottish Public Services now, they will still go back to the Christie Commission report as explaining what they are now doing in their jobs, essentially, and the way that public services are changing in Scotland. So what is happening, what they're doing. So it's outcome focused. It's the outcome that matters. You still hear that when you're speaking to public servants in Scotland. Above all, it's driven by the purpose. We still focus on delivering sustainable economic growth through our policy. And I did a blog post today, was a critical take on the
Fairer Scotland Action Plan, and they are highlighted how that theme of sustainable economic growth is still there in the Fairer Scotland Action Plan, and it's quite problematic there. So, and how that works actually in government is the government economic strategy is the most important policy the Scottish Government have, really. If you speak to a civil servant in St Andrew's House, it's the government economic strategy. And the argument is that a strong economy means we can have a strong government. If you look at the most recent government economic strategy that Nicola Sturgeon led rather than Alex Salmond, the language now has shifted to this idea of inclusive growth. And there's this nice handy little diagram in there which looks quite pretty, means absolutely nothing. Competitiveness, tackling inequality. It's like, it's yeah. Arguing it's mutually supportive. There are very, very simple arguments that you can make to argue that it's no, it's not. Actually, competition inherently leads to inequalities. But that's what the Scottish Government say. They argue that if Scotland is more competitive, then we'll have greater growth and we'll be a more equal society. Christie Commission put a lot of focus on what's now termed preventative spend. And this preventative spend, it was argued, needed to be evidence-based, and it was the contrast to preventative spend was what's termed failure spend. And this is the argument that if you look at the big chunks of expenditure that government does in Scotland, there are areas like dealing with poor health outcomes, so obesity, alcohol-related illness, areas like that. They're related to the fact that services have failed earlier to stop people becoming obese, to stop people over-drinking. If you look at social work services, they are focused on, this expenditure there is focused on crisis management and dealing with families and households that are incredibly chaotic and take a lot of resource just to stop really awful child neglect happening. Whereas if we could just shift the resource, shift that expenditure back to preventing that family getting to that stage, then we'll save money in the longer run. So it's the idea of we spend a little bit of money on prevention in the early stages of problems, then they won't turn into really big problems that later on that will cost a lot more money. Some good examples of this are the Triple P parenting scheme. You might have heard of this. It was led by Glasgow Council and the Greater Glasgow and Clyde Health Board, and it was run through the primary schools in the most deprived areas of the city, and it's an early intervention measure in families with young children to try and improve the outcomes for children as they grew older. The most high profile of these policies, and it's mentioned in the Fairer Scotland Action Plan, is the Family Nurse Partnership. This started off in NHS Lothian in Edinburgh, and it's been rolled out now across Scotland. That comes from the US. It comes from a lot of work in the US, and it's also was implemented in England around the same time, but on a much bigger scale. If you do my module in 3rd and 4th years called Contemporary Social Issues in Practice, I will talk to you more about the evaluation of the Family Nurse Partnership. It's really interesting, but I won't talk to you about it now. But first say, if you know anything about evaluation, so they did a randomised controlled trial in England, and there was an evaluation study in Scotland, but not a very robust randomised controlled trial. The point of these is, though, what I want to get to is that these evaluations of the Family Nurse Partnership in both England and Scotland actually basically suggested it doesn't make a difference. That the Scottish Government is spending a lot of money on a policy that doesn't work. That the traditional health visitor, every mother in the UK who pops out a baby gets a health visitor. And traditional health visiting services delivered by the NHS are as good as the Family Nurse Partnership and a lot cheaper to run. So there's also an evaluation of Triple P parenting that came out a couple of years ago, and that was very critical as well. Actually, it said similar things, that it's got these very big ambitions to deliver outcomes, but if you look at the outcomes it's delivering, it's not really working. So yeah, there's this idea that we can have this really strong evidence base. We know what interventions can work. We know where we can spend the money to prevent these problems later on. But actually, when it comes to it, a lot of that evidence base is quite weak. And some of the language that talks about, the one that's always used is the fire and rescue service. Fire and rescue service have put themselves out of business because they, for decades, their job has been to prevent fires. So they've changed regulations for things like household furnishings, and they've gone around putting smoke detectors in people's flats, in their houses, and taught people not to put their frozen peas in the deep fat fryer. So they basically put themselves out of business by preventing. And this is this is the model for preventative spend. It's like, yeah, that's really easy when we talk about sofas combusting. When we talk about a chaotic family with drug abuse and child neglect, a bit more complicated than just stopping sofas setting on fire. So yeah, questionable evidence base there, but it's a big theme in Scottish policy. The other element of the Scottish approach is policy in Scotland is about voice for service users rather than choice. And I talked about this last week when I suggested that actually we could think about choice in public services as a progressive policy. And it's very widely used in England as a way to deliver improvement in public services. In fact, just today there's a news story broken that the NHS in England is talking about allowing failing GP surgeries that don't have very many patients, to just close. So that's choice in action. But the Scottish Government, rather than going for choice, it's focused on voice, giving service users a voice in the delivery of service and making services better. So what does this look like? In health, there's an interesting experiment happened back in the first SNP Parliament between 2007 and 2011 on electing people to health boards. So the different health boards in Scotland, they have actual boards, people who sit around a table and make the decisions. At the moment, they're appointed by Scottish ministers. So the idea was, well, if we could elect ordinary members of the public to these boards, then it would bring in service user voices to this policy-making process. It let people we know more about services, and services can respond better to the demands of the local population within that health board area. The area I know most about from my own research is housing, where there's been big continued emphasis since 2007, and it's building on earlier work on tenant participation in the delivery of housing, in social housing. So there's now an expectation in law that housing associations will use tenants in a variety of different ways in making decisions about the way housing is delivered and the way that housing is managed. And the big sort of key policy in this area was the Housing Charter. And the Housing Charter sets out a number of obligations that housing providers have in terms of repairs and listening to tenants and delivering good quality neighbourhoods. And every year housing associations have to deliver a report on how they've met the charter and send it to all their tenants and get feedback from their tenants on whether this actually is a realistic account of the delivery of their services. The biggest, and that's I think the biggest statement of this bringing voice into public services has actually been legislative, and it was the Community Empowerment Act that was passed in 2015. And the Scottish Government spent a long time consulting on this act before it became legislation, and it sets out really bold ambitions for very, very deep engagement by public services with their service users and local communities. So it sets on new duties on local authorities, that local authorities have to work harder at doing this thing called community planning to listen to the communities that are out there that they serve. Communities now, you will have in a few years' time, we're just working out how it will actually work in process, the right to be consulted, I think it's called something like that. It's basically, if you as a community group think that your local services are failing, then you have the right to turn around to the service provider and say, no, you have to engage with us and work out a way to make these services better. And you can't ignore us. And this is a right that we now have. It also expands opportunities for people to run public services themselves and to own public services and run them through things like housing associations and community development trusts. So actually to take over public services from the traditional public sector. As I say, it was only passed in 2015. The implications of the Community Empowerment Act are just slowly rolling out. But the ambition behind it is actually implemented will make Scotland very different in the way that public services are delivered. And from 2007 to 2011 as well, another element to this was what was termed the Local Government Concord Act. So this was an agreement between the Scottish Government and Scottish local authorities that the Scottish Government would give them more freedom in terms of how they spent their money in return for the local authorities agreeing to deliver national outcomes. So previously the Scottish Government would say, here's X million pounds, you must spend it on this. Now the Scottish Government is saying, well, here's X billion pounds, you can spend it how you like, but in doing so you have to make sure that we have tackled the significant inequalities in Scottish life, etc., etc. These single outcome agreements that were agreed between local authorities and the Scottish Government. Rolling on as well, the big buzzword in public services now in Scotland, in policy making in Scotland, is what we term co-production. I could do an entire lecture on co-production. I don't have time, and you're all nodding off anyway, so I won't do. But it's the idea that actually rather than... Actually, a good example, I've done it myself in teaching. So how I'm boring you to death right now by speaking at you is how traditionally services are delivered. So I am professional, I deliver service teaching to you. 2 years ago, I was running a honours module called Governance and Participation, and at the start of the semester I said to students, I want to co-produce this module. What are you interested in terms of governance and participation? And they came back to me and said, oh, we're interested in these 3 things. So I got there's only 11 students, got them in 3 different groups, and the deal we did was if they taught for the last 3 weeks of semester on those 3 topics, then they delivered good quality teaching, then they would pass the exam, no matter what. They could just walk in and write their name and they'd still pass the exam because I knew they'd done some work. And so that was co-production in action. So the students were involved in choosing what they wanted to study and then also in delivering that service. So if you apply this to other services, it gets a bit complicated, but there's a lot of experiments now going on in Scotland about co-producing services, bringing service users in novel ways to actually deliver the service itself, rather than expecting professionals to always be the ones who are providing help to service users. So this very simple public services gets a key difference in the way public services and social policy is being delivered in Scotland. But what we face now, when we look at Scottish government policy at the moment though, there's quite a lot of tensions that are happening there. So on one hand, we've got a government that's committed to empowerment, to devolving policy making down to the lowest level. It's passed legislation that says it's going to do this. But if your local authority says, well, okay, well, we don't want to deliver this service anymore, and all our people who live in our local authority area say we don't need this service, we're not going to get it, then somebody might sort of say, hang on, but the neighbouring local authority gets this. So that's in tension with that universalism I talked about earlier, that the Scottish Government wants a standard level of services at a Scotland-wide level. So that devolution in local empowerment is in tension with this desire to deliver good quality services at a Scotland-wide level. It's almost as if they're arguing you can have community empowerment, but you can only be empowered to deliver Scottish Government policy. That's a really cynical take on it. The other big one at the moment, with the fact that the amount of money the Scottish Government has to spend is reducing, is in terms of the efficiency and savings. The Scottish Government has to save money year on year. Its budget isn't increasing, and it's unwilling to make the tax changes so that the amount of money it gets increases. So that's the other thing it's got to deliver. So an empowered community might say, well, actually, we don't want to eat less chips, we want to continue being fat, so you should give us better GP care to deal with our heart attacks. But the Scottish Government say, well, no, we've not got the money to deliver you better GP care, so sorry, you're going to die. So that empowerment is in tension with this desire to cut spending and to deliver services in a certain way, to deliver preventative services in a different way. So the Scottish Government's having to, when it's making policy, and when it's implementing policy, when it's actually doing things on the ground, it's having to deal with these tensions. And it's very adept. One of the things that's said about the Scottish Government since 2007 is it's been managerially very good. It makes very good pragmatic decisions to keep all of these things in tension just right, so that nothing really goes horribly wrong and everything's tickety-boo. And it's, yeah. So, just to end quickly with more of a critical trend, actually not end, I've got another 5 minutes yet, I've got quite a bit to cover. So I've said that policy is distinctly Scottish, but how distinctly Scottish is it? How could it might be a bit more critical here? Well, actually, the Scottish Government is doing a lot that other governments are doing, and a lot that other governments are criticised for doing. So this is my I hate Scotland bit. First of all, they're very managerial. So they still use input and output targets. The Scottish Government still bang on about police officers, and that's actually just gone on my microphone, and hospital waiting lists. That'll come up in when you talk about Wales and health policy in your workshops. You have this, everything's about outcomes. It's very managerial. They're doing what other governments are doing, and other governments are criticised for this. Also, when you look at this community empowerment agenda, why are they doing that? Who are they making responsible for policy problems? They're doing what we term responsibilisation. They're making us as a nation, we become responsible for meeting outcomes. So if we don't live longer, healthier lives, it's not the Scottish Government's fault for not making us eat fewer chips. It's our fault for being lazy bastards and eating too many chips. It's a sort of clumsy way. That's when you unpick the arguments they're made in policy, that's the sort of arguments they're making. They're still going back to that neoliberal conventional wisdom that it is economic growth that will deliver increased government expenditure. It's across all their policy documents, it keeps coming up again. We can't change this, we can't do anything different. This is the conventional wisdom. This is how we have to do things. Also, in the policy discourses, there's a lot of talk about tackling inequality. It's what the Scottish Government's all about. It's one of the things that arguably makes Scotland distinct from other governments. But in doing so, they dodge some very, very difficult choices. The most recent one was local taxation, the council tax, where, they made the system slightly fairer, but they've not completely reformed it, as everybody has been telling them to do since 1999, which would have made it much fairer. They've not changed income tax yet. So they're dodging the really, really difficult decisions that could actually deliver really big changes in inequality in Scotland, because they're a bit politically difficult to make. I just want to end by talking about the production of academic knowledge. A bit of a tangent here, but it's important to know. So, big thing that universities are measured on is the Research Excellence Framework, the REF. And basically what we'd have to do is, this happened in 2013, it's happening again in 2020. We send in our academic papers and they're judged by a panel based on this criteria. And this is the criteria for 4-star. This is the best quality research. So it's world leading in terms of originality, significance, rigour, yada, yada, yada. Exceptionally significant, multi-user data set or research resource. Now, so I'm an academic working in Scotland and I'm working in social policy, but this is the framework I have to work within. So I'm sorry, the issue is Scotland's small and not that interesting in policy terms. So if I do research in Scotland, it doesn't meet those criteria, just because unfortunately it's Scotland. I could do research about Scotland and compare it to, say, Norway and the Netherlands. That would meet that criteria. But just Scotland, it's not that interesting, unfortunately. That's just the nature of the academic discipline and what the knowledge we're producing. So we have a challenge here that actually you'll see on your reading list, and if you're doing Essay 2, you'll see there's not much written about Scottish policy, because there isn't the incentive for us as academics to produce this knowledge. We're not going to get benefits from it. And what you do find, so there's explanatory policy analysis out there. So if you read Paul Kearney's book, really good at explaining the basics, getting you up to basics. You've got more critical scholars who are going to add some of that critical edge. Professor Jerry Mooney at the Open University is very, very critical about Scottish government. And you've also got Professor Kirstine Wimmery here, who's quite critical of Scotland's care policy since 1999. If you're interested in comparative policy and comparing Scotland to other devolved areas, Professor Nicola McEwen at the University of Edinburgh has done quite a bit of work on this. But generally, don't be worried if you're finding it a little bit difficult to find stuff. You think there's some big mountain of stuff I've not read if you're doing question 2. Unfortunately, there isn't. Scotland's not that interesting in social policy academic terms. So just to wrap up then. So I've talked about devolution. We need to understand it as a continuing and varied process. It has led to considerable policy divergence. There's no doubting that. We have seen Scottish answers to Scottish problems. Policy in Scotland now is different because the Scottish Parliament gained powers in 1999. We have this focus on outcomes, this idea that preventative spend will be a panacea to solve our problems, and also this agenda of empowerment, empowering service users and communities in the delivery of policy. But critically, we could suggest, actually, is this just neoliberalism Scottish style? So on the website, you've got the devolution explainer, and then in the workshop, you'll have been exploring Welsh devolution, just to give you a bit of an idea of how things differ. So thank you very much.